Hello everyone. In this video, we will be discussing about the brachial plexus and their branches and the lesions in the brachial plexus. So first, we will be discussing how the brachial plexus is formed. It is formed from C5, C6, C7, C8 and T1. Okay. The five nerve roots are involved. Four cervical and one thoracic. Then they form the upper, middle and lower trunk. Then after the trunks, there are divisions, the anterior and the posterior division, and then it forms the cords, and then it has branches. So, what is the mnemonic? Remember to drink cold beer. Okay, roots, trunks, divisions, cords, and branches. Then next we see the and what is we need to remember in relation to the fascia. It is covered by prolongation of the prevertebral fascia. So brachial plexus will be lying behind the prevertebral fascia, and prolongation of a prevertebral fascia is axillary sheath. Then we see the brachial plexus branches. Branches of the roots. From the roots, we have nerve to serratus anterior, also known as long thoracic nerve, and it has root value of C5, C6, C7. Nerve to serratus anterior, long thoracic. Serratus anterior SA and long thoracic LT, salt. Okay. Then we have the nerve to rhomboids. Nerve to rhomboids is also known as dorsal scapular nerve. So two nerves, to the serratus anterior and to the rhomboids, that are originating from the roots. Then we have branches of the trunk, and from the trunk, only upper trunk has a branches. That is suprascapular and subclavius. One above one. Okay, above means supra and below means sub. So suprascapular, scapula के ऊपर वाली और subclavius, clavicle के नीचे वाली. That branch is given by the upper trunk. Then divisions. Divisions don't have any branches. Then we have branches of the cords. From the lateral cord. From the lateral cord, we have three nerves, that is LML. Okay, the mnemonic is LML. Lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. Lateral pectoral, musculocutaneous, and lateral root of median nerve. Then from the median root, medial cord. Medial cord, we have five branches, and that the mnemonic is M for U. Okay, M for U means medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, and medially which nerve we will be having? Ulnar nerve. Okay, medial pectoral, medial cutaneous arm, medial cutaneous forearm, and medial root of median nerve and the ulnar nerve. Then next we have the posterior cord. For the posterior cord, the mnemonic is ulnar. Okay, ulnar nerve is not the branch of posterior cord, but the mnemonic is ulnar nerve. So upper subscapular, suprascapular we have discussed. Supra is coming from upper trunk. But subscapular, upper subscapular, lower subscapular. Subscapular, scapula के नीचे वाली हैं जो वो posterior cord से आ रही हैं. Upper subscapular, lower subscapular, nerve to latissimus dorsi. Nerve to latissimus dorsi. Axillary nerve and the radial nerve. Axillary and the radial nerve. Now we need to remember the root values. Okay, so first we'll be discussing C5. C5 root value only, it is for nerve to rhomboid or dorsal scapular. That was branches of the roots. Okay, from the rhomboids, roots and C5. Then we have C5 to C6. C5 to C6 value is for suprascapular, nerve to subclavius, that were coming from the upper trunk. Then lateral pectoral and upper subscapular, lower subscapular and axillary. So six branches that have the root value of C5, C6. Which one? Suprascapular. That was coming from roots. Then we have nerve to subclavius. Suprascapular nerve to subclavius. These was coming from the upper trunk. Then from the lateral cord we have the lateral pectoral nerve, and from the posterior cord we have the axillary, upper subscapular and lower subscapular. Suprascapular, subscapular और सबक्लेवियस. ठीक है, तीन सब वाली, एक सुप्रा वाली और लेटरल पेक्टोरल और एक्सिलरी. इनकी रूट वैल्यू है C5 to C6. फिर है C5, C6, C7. ठीक है, तीन वैल्यूज आ गई मीन्स. एंड इट इज फॉर द नर्व टू सिरेटस एंटीरियर. सिरेटस एंटीरियर सॉल्ट वाली नर्व किससे आ रही थी? रूट्स. वी स्प्रिंकल द सॉल्ट्स ऑन द रूट्स. ओके, सो वो सॉल्ट वाली नर्व आ रही है C5, C6, C7. Then another is musculocutaneous and lateral root of median. लेटरल पेक्टोरल थी जो लेटरल कॉर्ड की 3 ब्रांचेस थी, लेटरल पेक्टोरल, मस्कुलोकुटेनियस एंड लैटरल रूट ऑफ मीडियन. Lateral pectoral gives C5, C6. Okay. Then what is left? Musculocutaneous and lateral root of median. That has the root value of C5, C6, C7. Then next we have C6, C7, C8. C6, C7, C8. Okay. 6, 7, 8. That is for the latissimus dorsi, thoracodorsal nerve. Then next, we are going one step above. Okay, first 5, 6, 7 were there. Then 5 छोड़ दिया, 6, 7, 8 आ गए. Then 6 छोड़ दिए, 7, 8, T1 आ गया. 7, 8, T1 is for the ulnar nerve. 7, 8 and T1 is for ulnar nerve. Then we have C8 and T1. Okay, behind only 2 are left. Okay, the पीछे वाले सिर्फ 2, C8 और T1. That is for the medial pectoral, medial cutaneous nerve of arm and forearm. So medial pectoral, medial cutaneous arm, medial cutaneous forearm. That is C8 T1. And then we have C5 to T1. Means all the 5 roots are involved. That is for the median nerve and the radial nerve. Median and the radial nerve. So once again we will remember. See, C5 only rhomboid, dorsal scapular. C5, C6 suprascapular, subclavius, subscapular, upper and lower, lateral pectoral and axillary, lateral pectoral and axillary. Then musculocutaneous and lateral root of median and nerve to serratus anterior. That is C5, C6, C7. Nerve to latissimus dorsi, C6, C7, C8. C7, 8, T1. 7, 8, T1. पीछे वाले 3 है जो उनकी क्या है, अल्नर नर्व. मीडियन नर्व और रेडियल नर्व 5 रूट वैल्यूज है, अल्नर नर्व की 3 वाली रूट वैल्यू है. एंड C8, T1 medial pectoral, medial cutaneous arm, medial cutaneous forearm. So if we will revise it 2 to 3 times, then we will be easily able to recollect it. Now we will be seeing the upper limb nerve injuries. Before that, firstly, we see in relation to brachial plexus. Erb's palsy is traction or tear of the upper trunk. Upper trunk tear हो गया तो which muscles will be gone? See, deltoid muscle will be gone, so abduction will be gone, and the arm will be hanging by the side. In infraspinatus means lateral rotation will be gone, so arm will be medially rotated. Biceps brachii, the flexion and supination will be gone, so arm will be extended and pronated. So it will be like waiter's tip, like the waiter is asking for tip, that position will be there. The arm will be adducted, medially rotated, extended and pronated. And which muscles are gone? Deltoid, infraspinatus and biceps brachii, dib muscles. Then we have Klumpke's palsy. Klumpke's palsy is due to lower trunk, and lower trunk will cause the claw hand, okay, due to the ulnar nerve. So this two we remember importantly. Then wing scapular serratus anterior thoracic outlet syndrome is same as Klumpke's palsy. Then next we see the upper limb nerve injuries. We will be seeing the location and which is the nerve involved at that location and which is the artery involved. Firstly, we are starting from above. So axilla or lateral thorax, or we can say the breast mastectomy. Their axillar dissection is done. So in that, what nerve can be injured? Long thoracic. Long thoracic, that was nerve to serratus anterior. And what is the artery injured? Lateral thoracic. Long thoracic, lateral thoracic. Then we have surgical neck. At the surgical neck or at the anterior dislocation of the shoulder, which nerve can be injured? Axillary nerve. And which vessels? Posterior circumflex. Circumflexly binding around the humerus. So posterior circumflex and axillary at the surgical neck. Then at the mid-shaft humerus. Mid-shaft humerus, which nerve will be involved? Radial tuberosity is there, radial groove is there. So radial nerve will be involved. And which vessel? Deep brachial. Then radial nerve can also be injured in Saturday night palsy, crutch palsy, screwdriver use, repetitive pronation and supination. Then we have distal humerus or supracondylar fracture or cubital fossa fracture. Which nerve will be there? Median nerve. And which vessel? Brachial artery. Then carpal tunnel syndrome and lunate bone pressure that can injure the distal lesion, cause the distal lesion of the median nerve. Then we have medial epicondyle ulnar nerve, and ulnar nerve can also be injured due to cyclist handlebar injury, and hook of hamate due to fracture hook of hamate. Then we have Volkmann's ischemic contracture that will cause AIN injury, anterior introitious, and Monteggia fracture. Monteggia is fracture of the proximal ulna that can cause posterior introitious nerve injury. Monteggia is pin and Volkmann is AIN. Volkmann AIN and Monteggia is pin. So let's remember again. Axilla lateral thorax में long thoracic, surgical neck या shoulder region में axillary, mid shaft, Saturday night crutches, screwdriver use radial, distal humerus supracondylar cubital fossa median, carpal tunnel lunate median. Then hook of hamate, handlebar and medial epicondyle ulnar. Volkmann's AIN, Monteggia PIN. Then here it is a diagram showing that which nerve injuries are common. So around the surgical neck, axillary. Then we have midshaft humerus, radial. Then we have median in the lower part of the humerus and in the medial epicondyle ulnar. So how will you remember mnemonic for it is from above downwards arm. Okay, axillary, radial, median and U. ARM U. So now we see the distortions of the hand. So we know that the ulnar nerve injury causes the claw hand, and the claw hand can occur in both the ulnar nerve and the median nerve injuries. And the clawing will be more in the distal lesions. So this is the paradoxical thing. Okay, we see that if the lesion is proximal, then more clawing should occur, then more deformity should occur. But here the opposite is occurring. If the injury is distal, then more clawing. And if the injury is proximal, then less clawing. Why it is so? Because the proximal lesion will also damage the flexor digitorum profundus. So that will paralyze the fingers in the extended position. So ulnar claw hand. Ulnar claw hand will be the last two fingers, the medial two fingers, the small finger and the this finger. So distal ulnar nerve injury will be ulnar claw hand at rest only. Then hand of benediction. Hand of benediction is proximal median nerve injury. Here the first two fingers that will be extended. And median claw hand means median claw hand means thumb and the adjoining fingers will be clawed. And then OK gesture. OK gesture is due to the paralysis of the medial fingers, that is the little finger region in the extended position. So OK gesture and ulnar claw hand. OK gesture में क्या होगी, पीछे वाली दो फिंगर्स हैं जो एक्सटेंडेड होगी और अल्नर क्लॉ में क्लॉड होगी. दिस इज इन दी ulnar nerve injury. And hand of benediction. Hand of benediction means we are not able to claw these two fingers and median claw hand. This is in the median nerve injuries. So now let's see the rotator cuff. Rotator cuff is also important in relation to upper limb. So what are the muscles involved in rotator cuff? Supraspinatus, infraspinatus, teres minor and subscapularis. And which is the left one muscle which we say, that is subscapularis. Okay. Supra, infra and teres minor and the subscapularis. Then we see the arm abduction. 0 to 15 degrees by supraspinatus and it is applied by the suprascapular nerve. Then 15 to 90 degrees by deltoid supplied by the axillary nerve. More than 90 is by the trapezius and the serratus anterior. Trapezius is supplied by axillary and serratus anterior is supplied by the long thoracic nerve. So supraspinatus, then deltoid, then trapezius and serratus anterior. And what are the tests for supraspinatus? Empty or full can test. And infraspinatus can be injured in the pitching injury. Then next we will be seeing we have discussed upper limb nerve injuries. Now let's see a little about the lower limb also. So first we will be seeing the muscles and the origin, insertion, nerve supply and action in relation to the lower limb. So gluteus minimus, that is from the outer surface of the ilium. Gluteus medius is also from the outer surface of the ilium. And gluteus minimus is inserted on anterior surface of GT femur, greater trochanter femur. Then medius is inserted on the lateral. Then they both are supplied by spear gluteal nerve and they both cause abduction at the hip joint. So they both are abductors. From the outer surface of the ilium, minimus is anterior and the medius is lateral and they cause the abduction, and the supply is by the superior gluteal nerve. Gluteus maximus is from the outer surface of ilium and along with that coccyx and sacrotuberous ligament and gets inserted into iliotibial tract and gluteal tuberosity. So minimus, medius and maximus. These are from anterior, lateral and posterior. So gluteus maximus will be inserted posteriorly only and it causes extension and the lateral rotation of the hip and it is applied by inferior gluteal nerve. Then is tensor fascial artery. Tensor fascial artery is coming from iliac crest and inserted into the iliotibial tract supplied by the superior gluteal. So superior gluteal nerve gives three branches to the three muscles minimus, medius and tensor fascial artery. And what is the function of the tensor fascial artery? It causes flexion and internal rotation. Extension and lateral rotation was due to gluteus maximus, but tensor fascial artery will cause opposite movement. Here I have mentioned wrongly. So in the book it is mentioned that it causes medial rotation and flexion. Now let's see a little about lower limb nerve injuries. In the popliteal fossa, tibial nerve can be injured and the vessel is popliteal artery. Posterior to medial malleolus, tibial nerve can be injured and the vessel is posterior tibial artery. And in the hip, sciatic nerve injury can occur. Popliteal fossa tibial, posterior to medial malleolus tibial nerve and hip sciatic nerve. Popliteal artery and posterior tibial artery. So that were all the important points in relation to brachial plexus, upper limb nerve injuries and a little about the lower limb muscles and the nerve injuries. I hope you will find this session useful. If you like my content, please do subscribe my channel. Thank you.